riding in the car with my wife when I got the email, and it was kind of a gasp moment. So thank you very much. I really appreciate it. I want to thank the committee, whoever, I don't know who you are. Thank you. Small mistake, but well, thank you. I want to thank Karen Estrella. I got the email and I shook my head immediately. It said, Karen is behind this, the leadership of Homes. She's been a great advocate in New England and done tremendous work for our industry, so thank you, Karen, and the entire board up there. All the state leaders for their advocacy and hard work that they continue to do every day all across the United States. I want to thank my mom and dad and my brothers for founding the great company, and it's been a great pleasure to work alongside my brothers and the leadership team at Cape Medical Supply. I couldn't do what I do in Washington and elsewhere if we didn't have great leaders back home running the show. I want to thank my wife and son for the time away that this stuff entails, and for the kind of endless ranting that she's had to endure over the last decade as I complain about healthcare policy. I want to thank everyone who's taken time to be here today. Those of you that I see in Washington roaming the halls, it's some of the same faces every year. Those of you toiling away in state government buildings every day, extolling the virtues of what we do, the services we provide, the value that we deliver. I'm very proud to be part of this industry and proud to deliver the outcomes that we know we do all across the country. I want to thank the past winners. When you get an award like this, to measure what it means, I think you look back at who's received it before you. People like Tom, Van, Kara, the great leaders there. That's some company to be a part of. If you're from Massachusetts and you win an award, there's actually a state law that says you have to quote JFK. So I had to get it in there. And JFK said the following: change is the law of life, and those who only look to the past or present are certain to miss the future. We are standing at interesting and dangerous times as an industry. Opportunity and peril are in equal supply. It is incumbent upon us as business leaders to focus on creativity and innovation, on making hard decisions and taking bold risks. We need to be smarter than ever with our planning, more on top of our budgets, strategies, and cultures than we've ever been. We also remember that advocacy is not an option, it's a responsibility. Who among us can tell our staff members and patients we are doing all we can for them if our sole focus is on running our business? How can we rest at the end of the week if we fail to make noise, fail to advocate, fail to challenge the trajectory of public policy? Our team members need leadership, our patients need a voice, and our lawmakers need information and accountability. And all those constituencies are relying on the people in this room, on this terrace tonight, to work on their behalf, to carry their stories forward, and to work for policies that will give them access to the equipment, services they need, and provide job security for the ones who provide those services. I want to thank Van Miller for the work he did over a 30-year period in this industry. I'm deeply honored to receive an award in his honor. Van always said he wanted to be remembered as a good guy. There are a lot of good guys in this industry. I think we all know Van was a great guy. Finally, I want to thank one of my peers and colleagues, Jack Hogan. Jack, because of some obligations, wasn't going to be able to attend MedTrade this year. And when he found out that I was being honored, he got on a plane this morning and flew down just for this. It's an honor to have colleagues and mentors like Jack and so many others in the room. Thank you so much for coming, Jack. Thank you all for being here. Thank you for the work that you all continue to do every day. I look forward to fighting alongside you all for positive change in the months and years ahead. Thank you.